If you're this desperate about Chris's weight, why don't you just suck the fat out?
Look, if you can find a hole on the boy that you want to put your lips on, be my guest.
Brian's cat scratch catastrophe, Meg's date turned medical disaster, and Peter goes under the knife. Get ready to laugh and hopefully learn a little, because today we're breaking down and reacting to all of the questionable medical scenes and colorful injuries from Family Guy. Let's dive right in.
If you're this desperate about Chris's weight, why don't you just suck the fat out?
Look, if you can find a hole on the boy that you want to put your lips on, be my guest.
We're talking about liposuction here.
That's called liposuction.
I'm not a plastic surgeon, but I've been in procedures where we've done liposuction before when I was working in the burn unit.
I'm talking about liposuction. My brother Broderick's a cosmetic surgeon.
To do liposuction, you're actually going underneath the tissue in the plane where that fat is, and you're taking a pretty rigid type of instrument going in and out of this tissue to almost break up the fat cells to get it out.
This is a very safe procedure, son. You won't feel a thing.
Anytime you go under anesthesia and have a procedure, there could always be reactions to medications. Have to just be monitored to make sure that you're not getting too heavily sedated and make sure that your airway is patent and you're getting good oxygen, all of these things. You're gonna have a lot of soreness and discomfort after when you wake up.
I'm like a green beret, you know. I sneak inside you and I skulk around like it's Vietnam or something, and I'm sneaking through the bush, you know, and I get all that fat, like the fat's my buddies stuck behind enemy lines or something, you know.
It's actually probably more of an art form in the sense of making sure the surgeon gets the right amount of fat out in each area that they're going, so that way it's like smooth, but you also want to make sure that they're doing it on plane, so they're not digging into the intra-abdominal cavity, they're not messing with your muscles.
Dad took me to a doctor to get the fat vacuumed out of my belly.
What?
I didn't do it. I'm just gonna stay on my diet and exercise.
Good for you. That was a very grown-up decision.
What is Stewie doing in the background trying to get the chocolate cake that's all over his face? Majority of like weight loss really has to do with calorie reduction, weight management, diet, lifestyle changes. And then isn't Chris underage at this point? I think there's a whole issue relating to pediatric patients going in for liposuction.
What kind of lazy, narcissistic, irresponsible moron would even consider doing something as unbelievably foolish as getting liposuction? Who, I ask you? Who?
Hello.
This is not a liposuction result. Typically, liposuction is done in specific areas of the body, not your whole body.
Of course, I'm beautiful. I mean, look at me. Ah, how strange. Should watch road, but can't look away.
Oh my gosh.
Too beautiful.
Have you ever met anybody that just stares at themselves in the mirror? Let me know in the comments. Oh jeez. Ejected from the vehicle. Typically, that means you're not wearing your seatbelt. Shattering of the windshield, thrown from the vehicle around 5 meters. That is a substantial amount of trauma that an individual would take, especially to their head. They could have intracranial bleeding, cervical spine fractures. Oh my gosh. Oh my gosh, he's drinking it. What?
Well, Mr. Griffin, the
Maybe not.
bandages are ready to come off. But I think I should tell you it's a miracle that you're alive at all.
Yep.
We did all we can.
They always in shows mummify people with bandages. Only like once or twice in my career have I ever had to put like a ton of bandages around somebody's face like this. Usually use it to keep a bandage in place, not because you need to wrap the person's whole head. Right, he's like a Mr. Potato Head.
And now I will take off this protective potato head mask.
Oh, there you go. Nice.
You look like you.
I can't believe you're all still standing by my side after what a jerk I was. Especially to you.
The effects on our body when we're shifting from excess body fat to underweight in a very short period of time, sometimes that's not good. One of the things that can happen if somebody loses weight too fast, and a lot of it, you increase the risk of getting gallstones. So people will typically have to get a cholecystectomy after they've lost a lot of weight.
So what should we do next?
Did she just get like drugged? Are there medications that would do this to you that fast? Maybe not that fast, but there are medications that you can take, like a benzodiazepine. Some meds that we use in the hospital, such as Ativan or Valium. The bad ones, Rohypnol or being roofied. It's in the same type of class of medication. Whoa, missing a kidney. Ice in a bathtub. So we're keeping things from bleeding, or we're trying to numb up areas instead of getting injected with anesthesia. I'm assuming this is a nephrectomy, which is a fancy medical term for kidney removal.
Oh my God! Toby, what happened?
Oh, I just harvested your kidney.
To take out a kidney, in general, you're going to be on a cardiac monitor. You're also going to have a monitor to see what your arousal state is. That way, the anesthesiologist can know how much anesthesia you need. Most of the time, the doctor is still going to inject some lidocaine into the tissue. That way, when you wake up, there's going to be some numbness to the area instead of discomfort from being cut.
Look at the size of this scar!
Sorry, it's my first day on this job.
Well, where did you work before?
Circuit City. So I haven't worked in like 2 years.
What you need to do is separate basically the ureter from the kidney, and then you also need to separate the vasculature from the kidney. So you need to make sure that one, you're not going to bleed out and die, and the other is to tie off the ureter so that way it's not leaking out into the abdomen.
Toby, I can't believe you took my kidney! You bastard!
Sorry, Meg. Black market organs are big money, and I promised my bosses a fresh kidney.
Kidneys are a hot commodity. A lot of people need new organs, multiple different reasons why a kidney would fail, that you would need it so you don't go on dialysis or to get off dialysis. Protect your organs, watch what you're eating, make sure that you're staying healthy and monitoring your kidney function.
By the way, did you know you had a tiny conjoined twin attached to your hip?
What? I don't think that twin is alive. And I think her dad had one too in other episodes. Looks more like what we call a parasitic twin. They're called a parasite because they're just using you for whatever resource that they need. Blood flow, oxygen, those sorts of things, other organs to function and stay alive.
Is it worth anything?
It is to me. I've been using it as a bookmark.
Wow. A lot of times people will have one ailment, they might be getting treated for one thing, and then we find a whole other issue and there was no symptom for it. This is super common in the emergency department where we're doing imaging because somebody has a complaint somewhere and then we find something else.
I had 6 brothers, but they'd all sliced off their hands opening a tennis ball can. Possibly the most dangerous object known to mankind.
Oh my gosh, how many out there have ever had injuries and worriedness related to tennis ball cans? It's crazy. It's like a super sharp seal.
Anyone want to play tennis?
What?
Llewellyn, no!
Oh man, they're so sharp. Put compression to this area. If you can't, because the bleeding is so brisk, you need to tourniquet this. It's gonna hurt like hell when you do it, but you gotta do it to slow the bleeding down. But it's this sharp of a cut and that big of a missing piece of your body, there's a potential chance a doctor can actually put this back together. So you would have arterial blood and venous blood. Arterial blood would be spraying with every beat of your heart. Venous blood would just be pooling out.
What the deuce?
Oh, fleas! Fleas probably related to the animals, usually are the ones that bring them in, or sometimes we see it happen when people live on the streets and they come into the hospital, they'll have all different types of bugs on them.
Stewie, you've got bugs on your jammies. Peter, wake up. Stewie's covered with fleas.
If you end up getting fleas, make sure you just take a shower, soap and water, get them off you. You're just going to treat symptomatically like all the bites and the inflammation. So hydrocortisone cream or calamine lotion, something to just ease the itch that you're going to get from the bites. Most fleas don't just naturally live on humans. They'll be on you causing irritation, but they're not festering on your body.
Oh no. Brian.
That's it. Time for Doggy to go the way of Old Yeller.
Yep. Obviously, please treat your pets because you're miserable, they're just as miserable. Fleas could actually live in carpets dormant for a long time. So if you move into like a new apartment or house, maybe make sure that they've already changed the carpets for you or have somehow disinfected them. In certain states and areas, it's actually the law that they have to do that.
There's only one thing to do. Learn the language of the fleas, earn their trust, then breed with their women. And in time, our differences will be forgotten.
Call the damn exterminator.
I would feel the same way. Call the exterminator, come and get the bugs out of the house. Trying to like clean the house, rid the house of these bugs. Hot water, steam. If you need the help of an exterminator, they know how to do it as well. Ooh,
Sorry,
acupuncture.
Dr. Lang, I guess I'm nervous. This whole thing's a little weird.
Ah, never you fear, laddie buck.
Acupuncture, it's another form of treatment, can be quite beneficial for individuals. They use very, 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 very skinny needles that are sterile to different areas of the body to affect other parts of your body. To balance your chi as well as the meridians.
What we call in my country, we feng chao hu.
When stress and sleep are off, people will look anywhere for relief. That's why me and my team created Life Happens, doctor-formulated supplements to support calm, sleep, and other recovery when life gets a little chaotic. You can find all our supplements at lifehappens.com or on Amazon.
Hey, Doc, you have to keep those two boxes right next to each other.
Why? What do they say?
I think we're through here.
At the hospital, sometimes we'll do trigger point injections or dry needling. Sometimes there's areas of the body where you have like a hypertonic muscle. If you stick a needle in it, it will actually cause it to like spasm and relax.
Okay, you go in there, kill Miss T, and we'll sneak out the back. You need a weapon or anything?
She's a cat. I'm a dog. I'm good.
My cat, Bond, she's a little feisty. She seems calm, she seems gentle, but she is one you know what. We'll see people get bit by cats and cut. The cat's bacteria in their mouth can cause us to have bad infections. The one that we always hear about, cat scratch fever, Bordetella hensleyi. Cats are pretty tough. Oh no!
It went poorly.
With any cat, dog, wild animal, if you are not familiar with it, just have cautions. You don't know if they have fleas, you don't know if they have rabies, you don't know if they've had all their shots, they might be aggressive, they might have some weird disease that they can pass on to you. So just be careful. Family Guy, this is fun to watch. Always fun that there are so many medical scenes and injuries that occur in this show. Good writing. If you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. And please make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.